is what's called the lazy S. And again, as with curving the ellipse, this is designed primarily to minimize the effect of a straight line on the skin, which tends to be more noticeable. So we're going to go ahead, I'm actually going to draw a lesion on the skin surface, like such. Okay, now, before you do the lazy S, it's good to practice kind of drawing it a little bit so you get a feel for what it looks like. So let's say, for example, this is my lesion on this piece of paper. Okay, what we're looking for is an actual curve line like such. That's what we're shooting for. This is called a lazy S. And if you notice this, and what we're going to actually do then is if this is going to have a lesion on, it's going to be one side or the other, we want to basically cut this out in a manner that's going to allow us to give us this curvature with the final closure. And where we want to have this is we want to actually have the straight portion be alongside the actual lesion itself. So what I usually do is on the actual person, I will draw a straight line on either side with my pen, whatever distance I want to have. Okay? I'm then going to take one side and kind of curve one side up and away a little bit, curve this up as well, and kind of bring it together like this. Now actually draw this on the patient. This side over here, I'm going to curve off this direction and bring this up like such and bring it together. What I want is this area right here should snug up very nicely along this side. This area should snug up along this side. So that's kind of what I'm shooting for. So if you draw like this parallel either side and just kind of curve each off a different direction, it kind of gives you some room to play with. We're going to do the same thing here. So I'm going to basically draw a line on one side and on the other side. Okay. I'm going to then curve this off like such. Curve down the other side. And I'm losing my pen already. Okay, coming in. And this is going to be interesting because we actually have the a crease right here, but that's kind of what it's going to look like. So I've drawn this actually out on the patient, and I would actually do this on the patient. And then I'm just going to basically just go ahead and cut this right along these lines. So I'm going to follow the lines. I usually start in the center, cut, then I'm going to kind of curve, keeping the skin nice and taut all the way across here, one edge down to one end, such. I then go over the other side, cut the straight portion through the skin. Definitely helps to have a nice sharp scalpel. Kind of pull this end in again, support the skin, kind of come across and cut the other end. Okay, same technique on the other side. Turn this just slightly so it can be a little better for the camera. Kind of follow right along the curvature of the line like such. And the same thing on this side. Kind of come up, come around the corner, and then tighten, and then basically come right together with it, like such. And then can pick up this piece of skin that hopefully has been cut completely through, which it didn't look like it was down here because the skin was so flexible. Get a little deeper here. Okay, it looks like it was pretty much here, except one side over here. Okay, good. Okay, I pick this piece up, cutting it away. Pick up this piece as we go along. Keep cutting loose the excess tissue as we go along. And there's our lesion actually in the skin surface. So you can see what we actually have here. This is, you take this little piece off right here. That's just some extra tissue underneath there. Just cut off so it's not in the way. Okay, so this is what we actually have now on the skin surface. So the lesion was in here, was basically cut out like such. And so again, I would check if there's any remaining portion of lesion down here. I will cut out tissue in that area as well. But this is what the lazy S is going to look like. It's not a real tight C. It's just kind of a relaxed C. Closure for this is very important because this needs to be closed up in a manner similar like what we did for the curvature of the ellipse, in that your first incision, not your first incision, excuse me, your first stitch is going to control all of the additional stitches that you put in. So if I pull the skin across in a manner, I can pull it across so it's going to close up nicely, or I can pull it across so it's going to form all sorts of different things. Here I can give a bunch of big dog ears this direction. If I pull the other direction, I can give dog ears the other way. If you notice that there's a dog ear on one side over here and on the opposite side at the other end, that indicates you just need to move your initial stitch a little bit. Okay? So what I'm going to do here now with this, and again, this is going to be a little difficult because there's actually a fold in the skin right there. But what I typically do is I'll go ahead and start by stitching through one side. And again, this is kind of the approach that I actually take with the patient as well. So I pick my spot on the one side, again a simple interrupted or a vertical mattress, whatever you're most comfortable with. I pop through one side, and then I'm very careful, and I'll kind of take this and kind of pull it across to see where I need to be. So that kind of fits, looks like that's probably a better fit, just kind of like that. So that kind of tells you where I need to be on the other side. So I can pick the skin up there, put my next stitch through there, and again, if this isn't right, I can go back, remove the stitch, and reapply it again. But this kind of gives me an idea. So when I pull this together now, just practice kind of pulling it together. Okay, that's going to close up pretty well. I'm going to have a little bit of a problem down here, but again, that's because of the crease down here. But this kind of gives me an idea of how to close this up, and everything is going to close up pretty well here. Kind of play with it a little bit. Maybe go back this way just a smidge or something like this might help a little bit, but we're still doing pretty well here. Okay, so this is kind of the idea, and then I put the first stitch in. And again, then the rest of the stitches would just be your simple interrupteds, whatever you need to finish closing it off. But this is kind of the idea that we're looking for. So the first stitch across, by looking at this, see that end is going to close up pretty well. This end, because of the material there, the excess skin is going to be a little harder to close up, but I certainly can kind of see that this first stitch is going to meet our needs in this position. And again, you always remember you have to play with the tissue a little bit as well. Okay? I always pull the knot off to one side, close it up, okay? Then I squeeze it a little bit,